We're live. Hey, Dr.
Hi.
Adrian.
Hi, Hannah.
Hey, viewers. If you're here, give us a wave so we know that you're here. We're excited to be here. I'm at the point in the year where my tubes of chapstick are all drained to the bottom, and the weather must have known it because we had a sunny day here in Virginia.
Yes, we had a nice day, sans rain. We love the rain because it helps the plants and it's great for many things, but sometimes it's nice to see the sun.
And I got to go in to be in person at Evotion, and it was such a treat to be in that space. It's so beautiful. There are a whole wall of windows in the back part of the business that just look out over water, and it's just a really soothing space to be in. So that was a real treat for me.
It was a treat to have you.
We are still in Black History Month, and I think we should celebrate Black History Month year round. So maybe we won't stop with this, but we definitely wanted to highlight a special someone tonight. Do you want to take it?
Yes. Tonight we're highlighting Dr. Rebecca Lee Crumpler. She was the first African-American woman, female physician here in the United States. She was born in 1831. In the 19th century, she was one of the first few also female physicians in the United States. She also was one of the first few African Americans to publish a medical book. Her book is named Medical Discourses, and covered topics concerning prevention of infant bowel disorders and also just the life cycle of people. She worked and lived in Virginia for a time of her life, and recently, in the last year and a half, Governor Ralph Northam declared March 30th as Rebecca Lee Crumpler Day, and that's also National Doctors Day. So that's very special in many ways. During her life, I'm not sure if she even realized how much of a trailblazer she was, being the first female physician in this country. Definitely a trailblazer for me, and has allowed me to be in this position in which I'm very grateful to be in. And I'm sure she probably felt the same way as I feel about my vocation and about my skill set and my whole purpose. My purpose here is to help other people. It's not to be one who gains accolades or gains financial incentives or really respect. It is to be able to use these talents, these skills that I've been given by God to help women, to help people to be the best that they can be and to be as healthy as they can be. And I'm sure that's something she strived for. And I'm just grateful to be able to feature her tonight.
And you had a special someone working with you this week, didn't you?
I did.
We were just talking in the room before we went live about her impact on you this week. You want to share a little bit about that?
Yes, I had this week starting our a nurse practitioner, Miss Mary Ebeniwe, soon to be Dr. Mary Ebeniwe. She is also my mom. She is a great part of why I started this practice. She is a lot of the brains behind who I am and just my foundation. And so it was wonderful having her. She's also featured on our wall this month, being Black History Month, African American History Month. We featured her on our wall. And so she was there spreading her goodness around and just her love, and everyone enjoyed having her.
Well, I love that it's a family business. I love the energy in the space. And speaking of leveling up, we're here tonight to talk about hormone replacement therapy.
Yes.
So am I correct in understanding that is something that will happen when you reach the menopause age?
Yes. Yeah, well, that's a good question. I like how you put the word or use the word age, because there are definitely some women who go into early menopause. And so early menopause is menopause that occurs before 40. It can occur for many reasons, both, I guess you would say, natural organic reasons, infection and surgeries, surgical menopause by having your ovaries removed for whatever reason before 40. And then you have those who become postmenopausal at the average age, which is around 51. And so hormone replacement therapy is used mostly in menopausal women to replace what they're lacking, which is the hormones estrogen and progesterone. Those are the main hormones that are given to women that are menopausal, but some also during that time period replace hormones with testosterone, but it's mainly estrogen and progesterone.
And that is meant to ease the symptoms that you would have of menopause. So I'm just rattling off what I know from just my common understanding, because there's so many things that you don't know until it's in the video game terminology, you get achievement unlocked.
Yeah.
You get menopause, achievement unlocked, and you join the sisterhood of all of these people who've experienced that.
Yeah.
And, so hot flashes and some things that we were speaking about last week in terms of vaginal dryness might be a part of it.
Yeah, and it was great to have Dr. Bernick on last week because he did touch on it a good bit when we were talking about vaginal dryness with the estrogen replacement, the vaginal estrogen replacement. And so even though women, yes, we need hormones not only just to feel great, but we also need it for bodily functions. And it does help with heart, our bones, and our brain health. And that replacement, that hormone is very important, estrogen specifically, and progesterone also. But the main reason to have hormone replacement therapy would to treat symptoms. And symptoms usually in menopause are hot flashes, night sweats, mood swings, vaginal dryness, fogginess, honestly, is also a symptom. Another symptom that many women do complain about is weight gain and where we gain our weight. After menopause, we generally gain our weight centrally, so around our abdomens, our bellies.
Mm-hmm. And would there be reasons to not do hormone replacement therapy?
There are reasons. Last week we touched on the study that was done for hormone replacement, estrogen replacement, and how that has affected how physicians and practitioners prescribe medications to patients. And so the main reasons that a woman would not want to have hormone replacement therapy is if she has a high risk for the adverse events. And so some adverse events include the main one that we talk about often is cardiovascular risks. So increased risk of heart attack and stroke caused by blood clots that can occur in the heart and the legs and the lungs and travel to the heart, causing heart attack, travel to the brain, causing stroke. And so those women who have increased cardiovascular risk should not receive hormone replacement therapy. Women who smoke, women who have a history of heart attack, stroke, women who have been menopausal for many years have increased cardiovascular risk. So recommendations are if you've been more than 10 years from when you start menopause, you have a higher risk compared to someone who is recently menopausal. That being said, and then women who have had a history of an estrogen cancer also shouldn't receive hormone replacement therapy. But that being said, there are also many other options for management of symptoms in this group. And these medications are non-hormonal. There is a medication called Brisidel, which is medication in other dosages used for other reasons, but at a low dose can be used for symptoms of hot flashes.
Would you like me to put that in the comment?
Yeah. Mm-hmm.
How do you spell it?
Brisdelle.
Okay.
Other medications, Effexor, Trazodone, again, used for other problems, but they can be used for symptoms of hot flashes and night sweats too. We talked a bit last week about phytoestrogens, plant-based estrogens, and how they can be used for symptoms. Of course, with any type of medication therapy, it's something that needs to be discussed between a woman and her physician to make sure that she is finding the treatment plan that is best for her and her situation. Everyone is individualized.
Okay, Trazodone.
Mm-hmm.
Okay.
And so these are medications that are used systemically, and that's what we're discussing mostly today, those medications that are used systemically. And even going further into hormone replacement therapy, there are different ways to receive it. And so the ways that you receive the therapy does affect what your risks are, or you have increased risk with certain ways that you receive it. So receiving the medication orally definitely does have you have an increased risk of cardiovascular events compared to receiving it by the skin, what we call transdermal. There are patches, there are sprays, there are gels, many different ways that you receive a transdermal. That risk factor is extremely low. Some would say that there's no risk at all, but I don't like to say that. That risk factor is low, and that's because of how the body handles the estrogen. How the body degrades the estrogen is different when you receive a transdermal.
And are there any supplemental non-medical treatments or anything that is there something else that people can do to support themselves through it?
There are, and oftentimes we say easier said than done, but living a healthy life, exercise, having a good diet, getting sleep, not drinking too much alcohol, not drinking too much caffeine.
Not being in a pandemic, then.
Not being in a pandemic, trying to be stress-free. All of these things play a role in how our body acts and reacts. And so it's not only for symptoms of menopause, hot flashes, night sweats, insomnia and such, but just overall well-being. And so, we as women need to remember that wellness needs to be a very big part of our day, and it needs to be a very big part of how we proactively care for ourselves.
That I've just recently, when I say recently, I mean like in the last week, started drinking more water.
Yes, hydration.
As a preventive, I think I will be grateful later because of this little act. It's just you don't think of that preventative healthcare as being something as simple as doing a thing like that, like building it into your routine.
Yeah. Going to sleep at 9 o'clock instead of 12.
Going to sleep is the key word, not laying down in bed and then scrolling, unless you're watching us, and in which case scroll away.
Yeah.
Only 15 minutes.
So when you drink more water, how do you feel?
Oh, I feel way better. And the other thing is I started to do it in the morning.
Yeah.
So the only thing is I don't allow myself to wear jumpsuits that often because it's harder to go to the bathroom. Because it does, depending on what you do for your job, you might not always be able to dart into the bathroom from your water tank. So you have to kind of plan out. Yeah. Plan when you're going to do it.
They really should make the buttons like closer to the right?
like those old-timey suits that have the little unbutton.
Yes. You remember in the restroom doing the jig, trying to use the toilet. I hope you're sitting down when you use the toilet to protect that pelvic floor.
Oh.
And not squatting.
Oh. Okay.
And that's something we can talk more about later, but sitting down relaxes the pelvic floor and allows the necessary angles for urination to occur properly. When you're standing, you are not allowing your pelvic floor to really relax and urinate. And so that can cause issues down the line. We should actually be sitting, not stooping.
Well, that's new information for me. I do sit in my home, but if I'm out and about, I was always taught growing up, if you're on a public toilet.
For cleanliness. Yeah. And I have discussions a lot about that, and so we talk about, hey, that's when you really think also about, I'm not rushing to the bathroom all the time. I should not be holding it to where I can't sit and clean off the toilet and then, I can't wait until clean off the toilet and sit down.
Okay.
So that's also behavior changes.
Wow.
But going back to your water, I'm glad you're doing that. Drinking at least half of your weight in ounces of water a day. So if you're 100 pounds, you'd be drinking about 50 ounces of water a day, at least.
What's 50 ounces? What's the conversion to ounces to cups? Does that put us?
8 ounces is a cup, I believe, right?
That sounds right.
About all those bakers out there, let us know. Are we right? Is it 8 ounces to a cup?
I've just started trying to guzzle at least a full big glass before I drink my coffee, and it's really helped.
Yeah. Caffeine is dehydrating. Caffeine is very dehydrating. And so increased caffeine, decreased water, and increased coffee, decreased actual water intake is not helpful. And we go back into, symptoms of menopause and the reason you need to increase your water hydration.
And Michelle is here and she's saying, wow, new information. And while we're on the toilet thing, I don't know if this is something that you recommend, but another life-changing thing for me has been the squatty potty.
Yes, the squatty potty. Yes.
We should do a
Where's
partnership.
it been?
That's a whole other thing. Oh, we're at our time, but I just wanted to say another thing, which is to compliment you. I've seen in the background, you're a mother, you've got young children who are running around, and you're starting this business. And when you said Rebecca Lee Crumpler originally, I remembered the name, but it was kind of foggy. I couldn't tell you exactly off the top of my mind what she's known for. So I'm glad that we revisited it tonight, because I think when I think about her patient population and what that must have been like for her, because I'm lucky enough to sit by your side and see, and just to think what you're doing is so incredibly amazing, and how you do that, and mother and everything all at once is just so beautiful. So I'm just so inspired by you, and by you reminding me about the contributions of Dr. Rebecca Lee Crumpler.
Well, thank you. You know what I think about when I think of her? Not only just, obviously the stress of the work and trying to give to others, but the amount of stress she would have had, period, on in her day to day with racism that she probably faced, and not probably, that she did face, and sexism that she did face, and how was she able to navigate that and still be an amazing person and contribute in such an amazing way. I think that's very astounding.
And the kind of people that she was seeing in her patient population were formerly enslaved people.
Yeah. Mm-hmm.
So people who might not have seen someone for quite some time. So just the work, in addition to the difficulty of doing the work, the glass ceiling she was shattering.
Yeah. There are many people.
Sorry.
No, go ahead.
I was going to say, I've been having fun with you. I wasn't even watching the clock. We've gone over our 15. So if you're watching now, it's time to go to bed.
Yeah.
All of us. What were you going to say?
I was going to say, over the years, we use that phrase a lot, I think, in the election before last, with shattering the glass ceiling with Hillary Clinton. But there are many women who have shattered the ceiling quietly, and so for us to be in this period where we are really focusing on social justice, we should also make sure we're focusing on social justice between ethnicities and races, but also with gender too. It's really important that we remember, as women, and just as a nation and as a world, that a lot of foundations occur or a lot of good things have occurred because women have started it, and it's time women get their due respect. So, and
started it while in many cases while they're also mothering.
Yeah. While they're mothering, while they're taking care of family, while they're they've been able to
caretaking in all the forms, not just mothering.
All the forms. Being support systems for friends, and they've been able to shatter the ceiling or make dents in the ceiling for us to be able to prosper from. So.
Well, I think on that note, put on your shoes so you don't step on the glass.
Yeah.
Thanks for joining us, you guys. I appreciate it. And if you watch this later, please drop us a comment. Let us know if you knew Rebecca Lee Crumpler. If you learned something new, we'd love to hear it. If you've got questions or ideas for future info sessions, please let us know. Thanks, Dr. Ojo Karen.
Thanks, Hannah.